Gluten intolerance, also known as non-celiac gluten sensitivity, is a condition where individuals experience adverse reactions to gluten, a protein found in wheat, barley, rye, and their derivatives. Individuals with gluten intolerance often experience digestive problems, such as bloating, abdominal discomfort, gas, and diarrhea. These symptoms may occur shortly after consuming gluten-containing foods. Nausea and vomiting can occur after ingesting gluten for some individuals. These symptoms can be particularly distressing and debilitating. Chronic fatigue and a general feeling of sluggishness are common complaints among people with gluten intolerance. This fatigue can be attributed to inflammation and the body's immune response to gluten ingestion. Joint pain and inflammation, often resembling symptoms of arthritis, can be associated with gluten intolerance. These symptoms can vary in intensity and may affect different joints in the body. Skin problems, such as eczema, dermatitis herpetiformis, and acne, may worsen or become more frequent in individuals with gluten intolerance. Clearing up these skin issues may be achieved by avoiding gluten-containing foods. Unexplained weight loss or gain can be a symptom of gluten intolerance. This is due to the malabsorption of nutrients in the small intestine, leading to changes in body weight. Gluten intolerance can cause anemia due to malabsorption of essential nutrients like iron, folate, and B vitamins. Anemia can lead to fatigue, weakness, and pallor. Irritability and mood swings are common psychological symptoms of gluten intolerance, and they can be particularly disruptive in daily life. Frequent headaches or migraines are a prevalent symptom of gluten intolerance. Some individuals may find that eliminating gluten from their diet reduces the frequency and severity of these headaches. Cognitive problems, commonly referred to as brain fog, can be a symptom of gluten intolerance. Individuals may experience difficulty concentrating, memory problems, and mood swings. These symptoms can significantly impact daily life. Some people with gluten intolerance report feeling anxious or depressed, which may be linked to the gut-brain connection. The gut's health can influence mood and emotional well-being. Celiac disease is an autoimmune disorder where the ingestion of gluten leads to damage in the small intestine. In contrast, gluten intolerance does not involve the immune system and does not result in damage to the small intestine, but can still cause discomfort. The exact causes of gluten intolerance, also known as non-celiac gluten sensitivity, are not fully understood. However, research suggests that several factors may contribute to the development of this condition. There is evidence to suggest that genetics may play a role in the development of gluten intolerance. Leaky gut syndrome. In this condition, the lining of the small intestine becomes more permeable, allowing substances like gluten to enter the bloodstream and trigger an immune response. Some people with apparent gluten intolerance may actually be sensitive to fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, abbreviated as FODMAP, a group of carbohydrates found in various foods, including some gluten-containing grains. The symptoms of FODMAP sensitivity can mimic those of gluten intolerance. An imbalance in the gut microbiome, a group of microorganisms living in the digestive tract, may contribute to gluten intolerance. Stress and environmental factors can exacerbate or trigger symptoms of gluten intolerance. Chronic inflammation in the body may increase the likelihood of developing gluten intolerance. Some individuals with other inflammatory conditions, such as irritable bowel syndrome, may be more susceptible to gluten intolerance. There's no cure for gluten intolerance. The primary way to manage gluten intolerance is to adopt a strict gluten-free diet. This means avoiding all sources of gluten in your food, which can be challenging but is essential for symptom relief. This gluten-free approach is considered a lifelong commitment, as reintroducing gluten can trigger symptoms. If you suspect you have gluten intolerance, it is advisable to consult with a healthcare provider or a registered dietitian who can provide a proper diagnosis, offer guidance on maintaining a gluten-free diet, and help you manage your specific symptoms and nutritional needs. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more. Thank you for watching. Until next time.